Okay, so tonight's topic is from EHO to tagging, what to expect on your first day as a houseman. Okay, so during previous session we have touched on clocking, on HO assessment, how to plan your posting accordingly. So today we will have a look on what to expect uh, on your first day of housemanship. Okay, and also we will go backward a little bit. Okay, so see what you should expect after e-houseman, and then during your PTM, hospital orientation, and subsequently tagging lah. Okay. Okay, so tonight's session will be about 40 minutes to 1 hour. Initially, I want to make it very short, but I realized that there's quite a lot to cover. And usually, the first intake of the year will include around 600 to 800 housemen per intake. But considering that the first intake of this year was postponed due to pandemics, there's a possibility that next intake in March will be a large one. Okay, it could be more than 600 to 800 as usual. So I think it is important for you to be prepared. Okay, because there's possibility that they will take more housemen. Okay, so let's be ready. Okay. Okay, so my presentation outline for tonight is, so within these 40 minutes to 1 hour, I will cover 5 core skills and knowledge for tagging. Okay, what are the 5 very, very important skills and knowledge that you need to know and you need to prepare for you to sail through your tagging or adapt faster to your working environment, and you can function better. Okay, next, apart from the skills and knowledge, what are the good attitude as houseman? Okay, so kita selalu dengar kan orang cakap houseman ni tak padas sangat pun tak apa, tapi kena attitude bagus, kena attitude bagus, kena attitude bagus. Okay, so let's define what is good attitude. Okay, actually one of the good attitude means you are knowledgeable, you are skillful, and you commit yourself to a long life journey as a doctor. Okay. Next, we'll go through a road to HO-ship, what you will go through and what you need to expect from e-houseman till tagging, and during each phase, what you can do to prepare yourself better, okay, before you start tagging. Okay, and we'll end with a pre-tag checklist. This is what are the important things you need to learn before you start working in any new department. Okay, so please stay with me until end of the session so that you can understand all the important points, and inshallah we will have a free giveaway for a clinical skills workshop on 21st February. Okay, there will be 3 lucky doctors. Okay, and please check the comment section just after we end our session, because I will choose randomly and announce in the comment section. Okay, then you will need to PM me to claim your free seat. Okay. So even before we start about our discussing about our 5 core skills and 5 core knowledge, okay, let us imagine this situation. Okay, I want each of you imagine this situation regardless whether you will be starting housemanship in next intake or you have quite some times to wait for housemanship. Okay, let's just imagine this together. Okay, so today is your first day taking in ONG. Okay, so okay, this is what will happen. This is first day of tagging. Yeah, so you have finished your hospital orientation the week before. Okay, so this is 8 a.m. on Monday. Okay, so you need to report duty to SCOG clinic. Basically, during orientation, hospital orientation, they give you the ONG lab book. So on your first day of working, that is Monday, Um, on Monday, you will need to bring that logbook to your department clinic. Okay, so if you are posted to ONG, you need to report duty firstly to SCOG clinic. So SCOG is specialist clinic or obstetric and gynecology. So if you're posted to surgical department, you will need to report duty to your surgical clinic and accordingly. Okay, so 8 a.m. Okay, so usually we will first meet the clerk of the department. Okay, so you will need to pass your logbook, your photos, and some other documentation. Okay, and okay, so the clerk said that you will need to meet your HOD at 9 a.m. And while waiting for your HOD, you were given a written test to answer while waiting. Okay, so usually during the first day of your department, in your a new department, you will need to meet either HOD or specialists who in charge of HO training. So they will brief you on what to expect from the department, roughly on how your assessment scheme, okay, and usually they will also assign you to any wards lah. Okay, so for example, if you're posted in ONG, after meeting with your HOD or your specialist in charge of with houseman training, okay, they will assign you for ONG. Usually you will start tagging in PAC or patient assessment center. Okay. So, okay, this is actually what happened to me when I reported to my ONG posting. Okay, so memang bila report duty, jumpa clerk tu and memang dia bagi written test and most of the answer memang I tak tahu. Okay. Okay. So, what do you feel? What do you feel right now? Okay. So TikTok, you're waiting for your HOD to come and you don't know how to answer most of the question on the written test. So memang dah palpitation, dah berpeluh-peluh walaupun dah makan pagi tadi. Okay. So dah sinus techie. Okay. Okay. So 9:30. Then you was informed that by the clerk that HOD had urgent meeting. So ordered you to go to tagging directly to PAC. Okay, fast alarm. Okay. So daripada klinik, so you cari PAC. Okay, so jalan. So you need to ask around where is the PAC. Okay. And arrive at the PAC after sesat sana sini sikit sebab tak tahu dekat mana kan. Okay. So when you arrive to the PAC, a senior houseman notice you coming in and he said, taggers, yeah, okay, I need your help. Okay, I need to go to OT now for standby because they just post emergency Caesar for fetal distress. Okay, so usually if you have fetal distress, we need extra houseman to resuscitate the newborn. Okay, some hospital, this is a houseman from pediatric department, but for my hospital, surprisingly, the resuscitation houseman is the houseman from ONG. So we will take extra houseman usually from PAC to stand by for the emergency C-section. Okay. So this senior houseman, okay, dia minta tolong apa? Okay. So this senior houseman say, okay, I already clerked this new case, a very simple case. They referred this patient from Klinik Kesihatan for induction of labour. Okay, so basically for induction of labour, straightforward case. Okay, and our MO will come up from morning Passover anytime. So usually the first thing in the morning in ONG department is all the MO and specialists will have a morning Passover. Okay, after some discussion, then only they will come to the respective ward. Okay, so this senior houseman actually have clerked this one case. And he need to go to OT. Okay, so he need your help to present the new case that he just clerk lah. Okay. And also, he said, oh, don't forget to review the CTG because we just start tracing for this patient. So nanti CTG dah habis tracing, you review, and then bila MO datang, you present lah. Okay, that MO you present properly lah. Okay, basically. Okay. So this is what could happen on your first day of tagging. Okay, it's a real case. This is what happened to me on my first day, and I didn't do ONG is my second posting. Okay. Okay, so I hope you have get a brief idea on what you will experience on the first day of tagging. Okay, so please comment what do you feel if this happened to you on your first day. Do you think you're ready to present the case? Do you think you can understand what are the documentation written by your senior houseman? Do you think you can review the CTG and comment whether the CTG is reactive, okay, suspicious or pathological, okay? Okay. Okay, Syazah Hasni kata nervous. Yang lain macam mana? What do you think? What do you think? Other senior houseman and other staff nurses at PHC are busy clerking their own case, and they are trying to finish the clerking so that by the time the morning Passover settle, bila MO datang, you are ready to present your case. Okay? Okay, so Divya Lechmanan said feels like need to be functioning doctor already, even first day of HO. Yes, because once you step to the department, when you step into the ward, you are just another houseman, and you are supposed, we expect you to do what any senior houseman is supposed to do. Okay. Okay. Okay, so it's okay. Okay. Okay, so based on this simple case situation, okay, let's see what are the 5 core skills and 5 core knowledge that you need for tagging. Okay, so first, what you need to know is how to clerk and how to review. Okay, so I believe before I continue your presentation, I think each of you need to have your notebook. Okay, there will be a lot of things and a lot of action plan that I need you all to jot down. Okay. And yes, ambil lah kertas ke, if you want to type in your phone ke, laptop ke. Okay. Okay, so first thing that you need to know is how to clerk and how to review. Okay, I think most of us are relatively familiar with the format of clerking. When you clerk patient, first you jot down the demographic details and then chief complaint, and then HOPI and the past of history, the format lah. Okay, for those who graduated from Malaysia, you are quite familiar with the format of clerking already. But as for review, so review, this is what you do during rounds, so how to update patient. Okay, this is quite new for most of us. Okay, and this will be your bread and butter as houseman. Okay, you need to do AM round, PM round. Some department have 3 round. Okay, TDS round. Okay, so for those who has joined advanced pre-HO, our mnemonics for review is the 4D SOAP formula: subjective progress, objective progress, your assessment and plan. And for plan, we use the Venom formula to formulate your own plan of management depending on your diagnosis and patient condition. Okay, it is actually very doable, and any houseman should be able to formulate a simple plan after you clerk or after you review any patient. Okay. So next, okay. So clerking and review. The first part is you need to know what to ask your patient. Okay. You need to know what to ask your patient during clerking of new case during review. Okay, next you need to know how to document this finding. Okay, so from your clerking session with your patient, your round session, when you examine your patient, when you order investigation, okay, when you review investigation from emergency department, okay, you need to document that in your case note or BHT or bed head decant, okay. And documentation also includes a lots of common forms, okay, your blood taking forms, your referral forms, okay. This is a very important skills that you need to have an idea so that you don't start from zero when you start housemanship, okay. Okay, so next is okay. So you know what you need to ask patient, what you document, and after you document your findings, you will need to know how to communicate this finding. Okay, so as doctors, as housemen, we communicate in form of presenting our new cases, presenting our review during rounds. Okay, we communicate in form of doing referral to other department, and also we communicate with doing radiological requests. Okay, and also posting case to NS team if you are in surgical based department. Okay, the fourth one is after you clerk, document everything, you present everything, then you have a lot of common procedures, okay, that we expect any medical graduates or any doctor should know. Okay, this is a basic procedure which we covered last time under DOP, so directly observed procedural skill. So blood taking, branular insertion, urinary catheterization. So you need to have some idea on how to perform this procedure. Okay. And last but not least is your physical examination, because when you clerk patient, when you review, you need to do a relevant physical examination. Okay. So this is 5 core skills for tagging. Okay, so Darren Lim said this need improvement with time throughout the posting. I suppose yes. With time, okay, you will improve obviously, but you will still need some basic knowledge or basic skills so that you don't start from zero when you become a tagger. So, okay, it is quite a lot to catch up, and you'll be overwhelmed if we don't have these basic core skills or basic knowledge that I will share later. Okay, because all these 5 things, okay, the 5 core skills and 5 core knowledge is something that you can work on during during the waiting time. Okay, so that when you start working as taggers in the department, you can appreciate what are the documentation done by your senior houseman. For example, in this case, at least when you see the clerking sheet by your senior houseman, you understand all the abbreviation. You can understand what is this case about, okay, and you kind of understand what are the plan of management. Even better if you can formulate the plan of management. Okay, it's because the plan is quite straightforward and pretty simple for the common cases. Okay, so it is very important to have a basic skills or basic knowledge so that you can appreciate and you can learn more during housemanship. Okay, I'll give more example as we go. Okay, so next is the 5 core knowledge. Okay, the previous 5 is skills, something that you need to know how to work on. Okay, how to do, and this 5 core knowledge is something you need to study, and at some point you need to remember by heart lah. Okay, so first one, okay, is common medication. okay, and how to prescribe properly. Okay, so you need to know what are the common medication, what are the available form, whether it's in tablet, in IV or IM, what are the dose, what are the frequency. Obviously, you can ask around, and you should have some reference. Okay, so for pediatrics, I think everybody knows this book. Okay, I took this from Medicorp lab. Okay, so this is your function. This is drug doses for pediatric. Okay, and drug doses for adult. Okay, I would recommend this book. Okay, let me. Okay, so this is book on common drugs. Okay, so they put the, okay, if you can see, okay, there's a generic name, brand name, okay, therapeutic class, and also the apa ni, the dosage lah. Okay, it might okay not be clear for you, but okay, at least you have this helpful reference. Okay, so waktu medical student, waktu apa ni, waktu tunggu posting ni, at least you remember the drug name, okay, the generic and the brand name, and also the classification. Okay, what group is it? Okay. Okay, so Sabrina asks, Frankshan still can be used starting 2021. So far, I'm not sure whether the new edition has come. Okay, so as houseman, usually we will need to use the latest edition of Frankshan. Okay, but you'll see some MO and specialists use the previous apa ni edition as well. Okay. Okay, let's continue with our 5 core knowledge. Okay, next is common diseases for each department. Okay, we have covered this topic, common diseases, during our last ME on HO assessment. Okay. Next is common investigation interpretation. Okay, this is something that you really can work on and you need to work on during your waiting time. Okay, so you need to know how to interpret CTG correctly, chest X-ray and ABG. Very basic. In all department, you will encounter chest X-ray and ABG on daily basis. In ONG, you will encounter CTG on daily basis. So there's no excuse for you not to know how to interpret this investigation interpretation. You should know what are the criteria for reactive or normal CTG, what are the criteria for suspicious CTG, and what are the criteria of pathological CTG. Even better if you know what to act on if you encounter this kind of CTG. Okay, for chest X-ray, okay, so you need to know what is normal chest X-ray. ABG, sorry, I forget another important one, that is your ECG. Okay, so please add on. So please, you need to know the basic one. Okay, so kalau ECG, what are the basic one? Your myocardial infarction, okay, your emergency hyperkalemia, okay. Okay, Hazika Hazlan asked about Blue Book apps for dosage. Is it recommended? Yes, you can use Blue Books apps as well. Okay. Okay, you can download it as well. And then, but I personally prefer something physical. Okay. So that I don't have to come to my phone frequently. But you can download the Blue Books apps. There's memes as well. Okay. So let's continue. Next is the normal lab values. Okay, this is also something that is lacking among our new taggers. Okay, so you need to know the normal lab value. this is something you really need to hafal lah, remember by heart, especially before you start tagging. Okay, so what is the normal value of hemoglobin, total white cell, platelet, renal profile, liver function test? This is basic one. Okay, so you need to hafal the normal value so that when you encounter an abnormal value, you know it is abnormal. Okay, there will be reference range for certain hospital, okay, especially in computerized hospital, okay, every result, okay, will be mentioned with the normal value, but still you cannot really depend on the machine, and it is something that all doctors should know by heart. Okay. Okay, and last but not least, common abbreviations. Okay, common abbreviation. So where you can learn your common abbreviation, this is from your apa ni, when you read a lot of documentation, for example from Ampang Ratio Guide, Amalina Notes, okay, and a lot of courses by Medicorp, departmental courses, and PHO, we include a lot of example of documentation so that you can appreciate the common abbreviation. Okay, the aim is at least when you step into the department, you see the PhD, you see the case note, you can understand all the abbreviation. And what's more important is you can understand the discussion during rounds, because during rounds we use a lot of abbreviation. Okay, so if you familiarize yourself with this abbreviation before you step into the department, it will be a huge help for you to understand what are the people discussing about during rounds. Okay, you can understand the BHT, the case note, the forms. It doesn't make you feel so dumb by needing to ask every single things. It's still okay. People will answer, but kita akan rasa macam alamak tak pandainya because everything I tak tahu. At least you know something. Okay, so that kind of empower you. Okay, at least you know something. Okay. So Afiq Shah asks, can we use CPG apps as references during tagging? Okay, you can use any apps, you can use any books, you can use PITS protocol in your PITS posting, you can use the JB surgery manual in surgical posting. Okay, but in order for you to use all these references, you need to be familiarized with it first. Okay, you need to at least go through the CPG before for you to know, what I want to know is in the CPG. Okay, what I'm trying to tell here is that all the apps, okay, most of the apps or CPG, the books, okay, won't be helpful if you don't read it beforehand during your waiting time. Okay, so walaupun bila kita baca tu kita tak ingat semua, tapi kita tahu, okay, I know there's topic on NNJ, there's table, and the table is different for term baby and pram baby. Okay, at least you know it's there. Okay, so when you encounter real case, you know where to refer to. Same goes to your CPG. Okay, so you need to know what CPG is there. Okay, what are the main topic discussed in the CPG, okay, for you to go back to the CPG when it's needed. Okay, we encounter a lot of housemen, even MOs who are not aware of the CPG. Diorang tak tahu, ada yang CPG on heart failure, ada yang CPG on diabetic management and pregnancy. Okay, so that's why I emphasize on long life learning. Okay, and this learning should start even before your housemanship. Okay. Okay. Okay, so this is our 5 core skills and 5 core knowledge. Okay, and along the way when we go through the road to HO-ship, okay, I will come back to this list. Okay, and we will see where and when you can what you can do to prepare yourself and make sure you know and still remember all this before you start tagging. Okay. Okay. Having said that, okay, about all the skills, all the knowledge. So does it really matters to be an excellent HO? Okay, so macam baca buku banyak waktu tunggu houseman ni, pergi course sana sini, okay. So all this online CME that you join during waiting time, does it really matter to be an excellent HO? Okay, so first you must remember that HO-ship is a marathon, it's not a sprint, okay. Actually it's a marathon with a lot of sprint in between. So you need to sprint during your tagging period, okay. So you need to have a very steep learning curve, okay. Then the rest of your posting is a long marathon lah, okay, with a lot of things to learn as well, okay. So apart from the skills and knowledge that you prepare yourself before starting housemanship, what more important or as equally important is your attitude, okay, your resilience, and also your support, the support you get from your close one, be it your colleagues and your family as well, okay. So I want to emphasize on good attitude that you really need right from the start, okay. Sometimes you don't have all the knowledge. We might remember what we have read. We might remember all the drugs name. We might forget all the drugs name. You might forget all the things you read because you are so nervous during tagging kan, okay. You hafal case tapi bila specialist datang suddenly you blank macam dekat exam because you are so nervous, okay. But this good attitude is something that you can work, and this is what actually differentiate one houseman to another, okay. Okay, so first, this is a very few example, okay, so that you can get an idea of what most of your seniors or your MOs define by good attitude, okay. So first, you need to be humble, okay. For this simplest act of showing your humbleness is to introduce yourself to your team, okay. When you're new, your first day, you come to the ward and everybody is doing rounds, okay. Just introduce yourself. Sorry to interrupt, I'm a new houseman. First poster, my name is apa-apa-apa lah, okay. So and it is extremely important to introduce yourself to the nurses, staff nurses especially, okay, because you work with them. So what I usually do, if every time I enter a new ward or every time I start my shift, I will usually introduce myself at the nursing counter. Okay, you can start something like, Assalamualaikum, staff nurse, saya houseman baru, nama Iliana. So kalau ada apa-apa yang saya boleh tolong, staff nurse boleh inform saya lah. Okay, show that you are approachable, okay, and you are there and you are willing to be part of the team and you want to help, okay. So next is try to be helpful, okay. Even though there's a lot of things, that we might not know at the beginning, you can still offer help with simple tasks. For example, bila you nampak sini houseman tengah ambil darah kan, you can bila you nampak you punya team tolong, contoh tengah ambil darah, okay, so you can learn and help how to print out the stickers. You can help them fill up the form together with them so that you know how to fill up the form correctly, okay. So it makes a huge difference, okay, between taggers who just stand there while everybody is doing their job, or if you have even if you are new, okay, when you see senior houseman is doing something, you can offer help. Can I help you with filling up the form, or what form do you need? I can help to find it for you, okay. Or if you see your senior houseman need to do some procedure, for example, blood CNS, CBD incision, so you can help by preparing the things you need to they need for that procedure. You can be chaperone so that you can learn how to do that procedure, okay. This simple thing matters, and it shows that you are proactive to learn, okay. So when you try offering help, okay, and try to be part of the team. People know that you wanted to learn. People know that you wanted to be as part of the team. Okay, so it is important to show interest during rounds. So jangan duduk belakang-belakang waktu rounds. Try duduk depan so that you can understand the discussion. Okay, ask questions appropriately. Okay. And then last but not least, you need to be responsible. Okay, be responsible of yourself means do not MIA. If you're having a difficult time, find people you can trust to communicate effectively. Okay, and not just macam disappear. Okay, make sure you are contactable. Okay, if you are not sure about something or you do not know, please ask. Okay, it's okay if kadang-kadang kita marah biasa, at least you learn something and your patient is safe lah. Okay. So there's a few questions. Okay. Divya Lechumanan asks, I've seen clerking by HO which state okay, use some abbreviation lah. Okay, so can we actually use some abbreviation? Okay, and Diana Nasiha answered, abbreviation are widely used. Okay, so okay, so regarding the common abbreviations, okay. Okay, yes, some MO and some specialists have their own styles and preference regarding the documentation, but the common abbreviation are usually used and accepted lah, okay. Most especially in KKM setting. In KKM setting, we use abbreviation widely, okay, in the documentation and also in our communication means during presenting case, referral, we use the abbreviation, okay. But what I know in some university hospital, okay, some senior lecturer usually do not prefer you use abbreviation, so you need to know, you need to document in full and you need to present in full as well, okay. So what you need to know is when you start your department, okay, you need to know your seniors and your superiors, how they work lah, okay. So usually the commons abbreviation are accepted. Okay, but few people don't like to use abbreviation, so you need to know which one to adjust your style of work lah. So you know if this you present with this consultant, okay, we need to present in full, okay. But usually you can use all the common abbreviation in KKM hospital, okay. So another good question by Nur Dahiyah, okay. Does it matter the discrepancy of normal range lab value between hospital? Okay, you just remember the standard one, okay, the one in your Oxford Handbook of Medicine, okay. That is the normal value, okay. So roughly HP is 13, okay. Platelet is 150 to 400, okay. 1,000 and leukocytic count. Just remember roughly the range, okay. Then you will see what are the range, normal range that is used in your hospital lah, okay. Okay, let's move forward to road to housemanship, okay. So we'll go through from e-houseman, PTM, hospital orientation, and tagging, okay. So a little bit on everything, what to expect and what you need to do at each stage to prepare you to become a better taggers, or so that you can adapt better when you start tagging soon, okay. So, okay, during about e-houseman, I don't want to touch on the technicalities of e-houseman. What's important is you choose your hospital wisely, buy wisely. The most important criteria, as I have mentioned again and again, is for you to be near your support system, okay, preferably within the same state with your family, okay. So you have all the support you need to go through your housemanship, okay. So this is the latest list of 49 training hospitals available for housemanship. So I add on Kuala Lumpur, Langkawi and Keningau. These are the new hospitals which are available for housemanship training. hopefully if the next intake is a large one, so you will have all the options available lah. Okay, so the red asterisk was previously meant, it is said that if you do housemanship in this hospital, you will need to be transferred to another hospital for MO-ship. Okay, so that is not necessarily true nowadays, because as a contract houseman, you will float for quite some time, few months up to 1 year in your same hospital, and most of MO will get a placement in different state, but some people manage to stay in their own state lah. Okay, so this red asterisk doesn't really matters nowadays lah. Okay, so choose your hospital wisely. Okay, you need to know what to expect from your hospital. Means you need to know at least whether your hospital is computerized system or non-computerized system. Okay. Okay, so what you need to do after e-houseman. Okay, so after e-houseman, there will be a lot of documentation. You need to prepare all your certs, medical checkup, photo, blah 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 blah, banyak lah kan. Okay, so I won't touch that because you have a lot of reference prepared by your senior houseman. Okay, yang baru habis baru masuk houseman the previous intake, they know exactly how to prepare the department. There's a lot of checklists that you can refer to. Okay, so what's more important is, okay, to get to know your hospital and your senior houseman. Okay, so how to do this? If you know your colleagues or your seniors who has started working in that same hospital, so you can ask them on what to expect about your hospital. Okay, and for example, which department are currently in need of housemen. Okay, so usually there will be a seasonal shortage of housemen. So the current houseman in the hospital know if you start in 1 month, okay, what will be your first department lah. Okay, so biasanya tak cukup houseman is medicine and ONG lah, because these two department need a lot of housemen to run the whole department. Okay, so you need to survey accommodation nearby a hospital. Okay, whether you want to stay in hostel, whether you want to stay in you want to rent the house or apartment nearby. Okay, and also this is the time for you to get the things you need for work. So usually it's your lab coat, HO kit, any books you feel that might be helpful during housemanship. And most importantly, don't forget to prepare yourself. Okay, so after a long period of rest, this is where you need to build your physical and spiritual fitness as well. Okay, you will need them both during tagging later. Okay, I think someone asked, how long do you have from e-houseman to starting working as houseman? Okay, let me see. Okay, Bong Pengda asked, may I know how long after e-houseman that we need to start the housemanship? Okay, so basically from e-houseman to PTM, you will have about, usually it's 3 to 4 weeks. Usually 3 to 4 weeks. After you choose your hospital, you have 3 to 4 weeks to prepare all the documentation, your medical checkup, before you need to report duty during your PTM. Okay, but during pandemics, there won't be PTM. Okay, so I don't know whether they do PTM if your PTM is expected to be in March. Okay, so they could do a mini PTM that is only 3 days, or they might require you to directly go report duty to your hospital and start your hospital orientation. Okay, so PTM is usually 3 day to 5 day. And then you will have hospital orientation depending to your hospital. Some hospital have 3 day of orientation. Some hospital have up to 2 weeks. Usually the computerized hospital, okay, will have a longer hospital orientation duration, because they will teach you how to use the IT system during this orientation. Okay, and then during your hospital orientation, usually towards the end of your hospital orientation, you will get to know which posting you will start. Okay, and then you will start tagging. So tagging, as we have discussed before, are usually 2 weeks. Okay, 2 weeks minimum for first poster. Okay, before you will have to be assessed, or you will have your off-tag assessment, and you will start your independent shift. Okay, so usually from e-houseman till start of working, actually they officially you start working on your first day of PTM. That is your first day as a government servant. But most of you most of us understand that start working as tagging. Okay, so from e-houseman to PTM you have 3 weeks to 4 weeks. So on your hospital orientation, so you have 5 to 6 weeks lah, okay, from e-houseman to start off tagging. Okay, so Ain Nazia asks, when will we know which department? Usually during your hospital orientation. Okay, usually in the middle or towards the end of your hospital orientation. Okay, so Durham Lim asks, in computerized hospital, when we do review or clerking, do we directly do all the inputs in the computer, or are we allowed to write on paper and transfer the computer if you are a slow typer? Okay, Darren. Actually, the issue is not whether you are slow or fast. The issue is whether you have a lot of computer available. Okay, the issue with most of our computerized hospital is they are not so many computer available. You only have computer at your nursing counter. So most of the time you will need to document everything on your paper first. Then when the computer is free or available, then you go to the computer and type everything. Okay, but some hospital have a lot of laptops. So apart from PC at the nursing counter, they have few laptops in every wards. So if you have that laptop readily available, you can directly type your notes there lah. Okay, but as taggers usually what we'll do is we will jot down in our macam notebook first, okay, and then only we'll go to the laptops. Okay, even in a traditional hospital or non-computerized hospital, what usually new taggers do is they will sketch ataupun macam jot down the importance point in rough paper, and only they transfer everything on the clerking sheet. Okay, as you go, usually senior houseman, diorang dah biasa, they write directly on the clerking sheet lah. But as the beginners, we might need sometimes or some practice. Okay, so it's okay to do your own notes first before you key in the notes in your computer. Okay. So Nurul Ainul Nabiha asks, in case our hospital allow the HO to choose our own posting to be scheduled, would you suggest any particular department as first posting so that we won't be overwhelmed? Okay. Okay. So if you can choose your posting, yes, very there's a few hospital that allow you to choose your posting. As far as I know, HUKM and Hospital Klang, one of the hospital which allow their housemen to choose their own posting. Okay, so my advice is, okay, if you can choose, start with surgical based department first. Okay, either surgery or orthopedics. Okay, because this surgical based department are usually have less workload because they have less number of patient, and they also have a slower patient turnaround. Means in surgical and orthopedic ward, usually you have less admission during every day compared to ONG or medicine. Okay, so you have less patient coming in, and all the patient will spend few days or at least weeks before op, operation day and post-op. Okay, so there's less discharge and there's time for you to understand your case better. There's a lot of time for you to polish on your 5 major skills that I mentioned before: how to clerk, how to document, how to present. Okay, so you can take time to learn. If you start with less busy department, this is usually your surgical based department. Okay, but what you need to know is, first, that is my general recommendation. You need to ask. If you may choose, you need to ask from your senior houseman. Okay, so usually senior houseman know which department are taggers friendly, okay, less risk to be extended, relatively more benign MO and specialists. Okay, so your senior houseman know better which department are the best one for first poster lah. Okay, for example, I might recommend surgery, but in your hospital, surgery is a very malignant with high ascension rate, so don't start with that. Okay, so please counter check with your senior houseman as well. Okay, but usually you don't get to choose. You don't get to choose, and most housemen will need to start in medicine or ONG. So at least be prepared for medicine or ONG. Okay. Okay, Bong Pingda asked, he heard that a friend that we would need to wait only for 2 weeks. Okay, there's one intake which have only 2 weeks from e-houseman to the PTM. Okay, that happened once, but usually you will have at least 3 weeks. The average is 3 to 4 weeks. Okay, from your e-houseman to your starting of PTM. Okay, another question Aina Ziha asked, do HO usually provide with locker to put our books or bag? Okay, usually we put our bag in pantry. Most hospital don't have HO resting room. Okay, so usually we put everything in our pantry or our discussion room. Okay, but there will be a designated area for you to put your things safely lah. Okay. Okay, let's move forward. We have covered what to do after e-houseman. Prepare your documents, but don't forget to prepare yourself as well. That's more important. Okay. So, okay. For Medicorp alumni, means anyone who has attended our clinical skills workshop or joined our online courses, my team will email a mentorship form after e-houseman is closed. Okay. So if you submit this mentorship form, you will get intense revision or every other day revision from e-houseman to PTM, and if I have time, I will follow up you all through WhatsApp. Okay, personally on how your progress during tagging everything. Okay, and with this mentorship program also, you will be able to join WhatsApp group with senior houseman from your hospital. Okay, so that you can ask your senior houseman about how is the accommodation, what are the tagging requirement, okay, and what to expect from your houseman lah, from your hospital. Okay, which department currently in need of houseman. Okay. So Muhammad asked, when is the next mentorship intake? Okay, so the next mentorship intake is when the next e-houseman opens. Okay, after a few days of opening, usually e-houseman opens on Wednesday. Usually it's Tuesday or Wednesday. Okay, when e-houseman open, my team will distribute the mentorship form for our alumni through emails. Okay, and we will usually open up a mentorship program for others as well with minimal fees so that you can join the intense revision as well. Okay, so a few days after the e-houseman opening. Okay, So Ain Najiha asks, can you suggest how to maintain our stamina during tagging? When to still sometimes to eat, to sleep or to study off tag? When to eat before you start your shift? Makan before start shift, okay? And along the way lah, biasanya tak sempat makan for the first few days, it's okay, minum air pun tak apa, okay? Tidur balik, kita akan pengsan, kita akan tidur, jangan risau. When to study to off tag, okay, study untuk off tag ni biasanya susah nak baca buku, you can ask your senior houseman. Bila tagging tu, actually you spend quite, you will always be with your senior houseman kan. Kita dalam ward je daripada 6 pagi sampai 10 malam. So akan sentiasa bersama-sama dengan senior houseman. So tanya je senior houseman, off tag assessment biasanya diorang tanya soalan apa soalan apa, dah tanya soalan apa, tanya balik, jawapan dia apa. Okay, that's how you learn. That is the best way to learn lah, okay. And you learn while you're clerking new cases, you learn when you learn how to review cases, you learn by learning and joining and seeing how your senior houseman attend to the emergency cases during their night shift. Okay, that's how you learn to off tag. Okay, so the definition of studying is quite different. Tak buka buku pun tak apa, as long as you know. So you can ask a lot of questions, okay, and identify the good seniors yang suka mengajar, suka explain things. Okay, there's a lot of senior houseman, there's a lot of MO who likes to share and teach, provided that you show your proactiveness. Okay. So I know Nabiah asks about e-houseman. Can I know whether we have the guideline to fill it? Okay, there's official e-houseman guidelines by KKM. You can download it from KKM website. And there's a lot of guide on e-houseman, screenshot videos or what exactly the system looks like just after it opens until you get to your surat tawaran. Okay, so this guidelines and references will be shared a few weeks or few days before the houseman is open. Okay, so don't worry about that. As long as you are in the group, the intake group, pre-houseman group, or if you follow my Telegram channel, usually you won't miss it. Okay. Okay, so Darren Lim asks, is the off-tag assessment in the form of oral? So off-tag assessment, it depends. Some department have a written test, but usually it is viva lah. Okay, first you need to fill in your tagging log. Okay. And then usually the off-tag assessment is viva, because the aim of off-tag assessment is they need to make sure that you are ready to do your independent shift. So usually whether you know how to identify unstable patient, what to do, okay. Okay. Again by Darren Lim, very good question. May I know, is the off-tag assessment conducted orally only or by bedside? Okay, so it depends. Okay, for example, for my ONG posting, okay, so when you start tagging in ONG, your off-tag assessment will be the day 14. Okay, the first day you start in the posting is day 1. Day 14, during the TDS or night round, that will be your off-tag assessment. Okay, so usually the specialist on call will start the on call round by asking, okay, siapa houseman yang off-tag hari ni? Okay, so they will ask us to present pathogram, okay, or do VE, and the specialist will see whether your VE is correct. Okay, so the specialist will ask you to interpret CTG, whether you can interpret CTG correctly, and also they will ask a common question about management of patient lah. Okay, for example, when you need to induce patient, different types of patient. Okay, so your off-tag assessment could be bedside. Okay, and it could be formal lah, means one-to-one with you and your MO. Okay, so when you start your department, when you start tagging, you need to ask around, okay, how the off-tag assessment will be conducted, what are the common questions, okay. And when you ask the common question, don't forget to ask the common, the answer as well, like that's how you learn, okay, because it is quite impossible to open up books during your tagging, okay. So your tagging is 14 days, 2 weeks. Usually you will have one off day, every week you have one off day, but some department tak ada, it's straight 14 days. So it's quite tiring. It's really tiring and quite difficult to find times to study for your off-tag. Yes. Okay. So Syuhada Subri asks, okay, macam mana mentorship program dijalankan? Okay, so basically mentorship program ni, I will blast a revision from my WhatsApp to a group of participants. Okay, so this is what we call a WhatsApp broadcast. Okay, so usually orang yang buat business lah pakai WhatsApp broadcast ni, so they can blast a message to a lot of people, but each individual people will receive the message personally. Okay, so you will receive a personal message from my phone. Okay, so if we have 500 people in that mentorship revision, so I will blast message to 500 participants, but you will receive a personal message from me. Okay, so ada steps lah, you kena daftar and you need to save my number. It's my working number. Okay, so my new number, so you need to save my number. So we will add you in the broadcast list and we will blast message. You will get this message personally from me. So tak masuk dalam group apa-apa. Okay. And this mentorship revision includes a lot of tasks. Okay. Dia macam, saya tak ajar sangat lah. Saya ajar juga tapi saya akan bagi task. So task ni macam case situation tadi lah. Your senior houseman minta present case. So saya bagi case. Okay, so I will wait. I usually give 24 hours for you to do macam buat script lah. Okay, and then I will assess your answer, and from your answer, I will comment lah. Okay, dan saya akan bagi skema jawapan. So kalau you nak tanya soalan, you can ask directly to me via WhatsApp. Okay, so we will have macam a new task selang sehari lah, and discussion. Okay. So that's kind of macam nak jumpstart your brain before tagging lah. So saya akan bagi a common case situation macam saya share tadi. Contoh case kalau patient tiba-tiba SOB, what you need to do. So you list down what you need to do. So saya akan comment dan bagi jawapan lah. Okay, macam nak buat refer, macam nak buat discharge, okay, macam nak buat review. So we'll practice those things. Okay, you will need to do. Obviously saya tak boleh nak check seorang-seorang. Saya will check seorang-seorang, but I tak semua yang submit the homework. So it depends on them lah. But most of those who are dedicated, at least 60 to 70% memang akan jawab soalan sebab takut dia nak masuk houseman. Okay. And we will do discussion along the way lah. Based on the case, kita akan buat discussion. Okay. Okay, let's continue. You know what to do after e-houseman. So those who has joined our online course and our clinical skills workshop, be alert with any email from Team Medicorp. Okay, Atira Rostam asks, how long is mentorship program per person? Okay, so mentorship program akan start daripada lepas e-houseman tu sampai you start tagging. So usually it's 3 or 4 weeks lah. So biasanya akan ada, I think about 10 modules, 7 to 10 modules depending on the time that we have. 7 to 10 module or case discussion, and sometimes I will follow up until after you tagging juga. Okay, so it's sebab dia serentak, semua orang akan serentak. Okay, because saya blast message tu through WhatsApp, semua orang akan dapat serentak lah jawab that task. Okay, and jawapan. Okay, so let's have a look on what you will encounter during PTM. Okay, so PTM pula. Okay, but bear in mind, kalau tak ada PTM, means you will start waktu pandemik ni memang bukan previous intakes, those negeri-negeri yang ada PKP, okay, PKP ke PKPB, so state tu tak ada PTM. So tarikh yang sepatutnya you start PTM tu, houseman kena report duty ke Jabatan Kesihatan Negeri ataupun respective hospital. Terus pergi hospital and start hospital orientation. Okay, so kalau tak ada PTM, means you akan start tagging jauh lebih awal. So lebih awal seminggu lah, okay. Okay, so kalau ada PTM, PTM sangat best sebab kita akan makan dekat hotel, duduk dengan talk. Okay, so just sit, eat and do not run. Okay, so this is a good time to get to know your colleagues. Okay, so you will have PTM with your colleagues yang akan kerja dekat satu hospital yang sama, satu state yang sama. Okay, so get to know your friends lah. Okay, so what you can do during PTM, so what I recommend you to do and what a lot of our alumni do adalah mereka bawa all the notes of pre-HO notes lah, pediatric crash course note, ONG crash course note. So during the talk ataupun sambil-sambil PTM tu diorang baca balik lah apa contoh atau format documentation, nak isi borang tu macam mana. Okay, hafal-hafal lah normal value tu. Okay. Okay, so this is time to brush up your 5 core knowledge, especially N and A. N is your normal value and A is your abbreviations, okay? Sebab normal value kalau hafal awal-awal pun, you all tak deal with it every day kan? So biasanya akan lupa juga, okay? So few weeks sebelum start tagging tu, cubalah hafal secara intensif, okay? And tengok balik contoh-contoh documentation dalam Ampang HO Guide, okay, so that you are fresh with the abbreviation as well, okay, normal value and abbreviations, okay. And there's a lot of talk during PTM, okay, most of them waktu PTM tu memang kita rasa macam apa benda ni tak relevan sangat, but they are extremely relevant, especially on contract MO and further career pathway. Okay, these are taught by KKM, bahagian perkembangan dan latihan. So you need to know them lah. Okay. Okay. Okay, hi Ang. Dr. Ang Hui Min is my friends juga waktu ONG posting. Now she's ONG specialist already. Okay, so next is hospital orientation. What you need to expect. So hospital orientation is 3 days to 2 weeks depending on your hospital. Usually computerized hospital will have longer hospital orientation. Okay, so what they include in your hospital orientation. Okay, you boleh tanya nanti bila masuk dalam WhatsApp group senior houseman, rajin-rajin tanya soalan. Okay, so usually your senior houseman are responsive provided you ask question lah. Okay, so boleh minta daripada senior houseman apa contoh jadual hospital orientation, so that you know, at least you know your hospital orientation is how long, berapa hari punya hospital orientation tu, dan apa yang mereka include dalam hospital orientation. Usually these are lots of administrative talk. They will bring you tour the whole hospital so that you know you punya lab dekat mana, ward dekat mana, OT dekat mana. Okay, so usually akan ada blood bank and pathology orientation, means they will teach you on how to properly fill in the transfusion form. Okay, how to avoid a near miss or transfusion mistakes. Okay. And most hospitals include basic life support as well. Okay, and for computerized hospital, okay, the majority of time will be spent on how to use your hospital IT system, EHIS system lah. Okay, so hospital orientation is 8 to 5, usually 8 to 5. Okay, but very few hospital pagi ada very few hospital yang 8 to 5 you duduk dekat hospital admin, dekat admin lah kan, dengan talk everything. After 5 you need to go to ward. Okay, ada juga yang pagi you kena duduk dekat ward, after 2 you go to your admin office. Okay. Okay. Okay, so during hospital orientation, this is again a good time to get to know your colleague, especially if you don't have you don't have your PTM. Okay, so what you can do during hospital orientation, because it is usually a 8 to 5 apa ni, you only need to spend 8 daripada 8 pagi office hour je lah untuk hospital orientation. So you will have the night free, you have the apa ni, lunch hour free. Okay, and sometimes the talk finish much earlier. Okay, so you have time to revise, and please share all the 5 core skills with your colleagues lah. Okay, so some housemen yang bagus, diorang buat macam study group during the hospital orientation. So after 5, they stay back for 1 hour. So they share how to do rounds, okay, how to fill in forms, how to do referral. Okay, so they revise all the things they learn during their pre-HO and share with their colleagues lah. Okay. And most importantly is to arrange for pre-tag with senior houseman when you get to know your first posting. Okay, so basically the concept of pre-tag is something that I recommend you all to do once you have bila dah tahu you punya posting tu. Okay, waktu hospital orientation kan dah tahu kita punya first posting, and usually you will have weekend off before your actual taking start. Okay, so that weekend is a golden opportunity to have a look to your macam pergi do some orientation, ward orientation before your actual tagging start. Okay, so sebab hospital orientation ni, they orientate you to your hospital, they don't orientate you to your first posting. You need to orientate yourself to your first posting, okay, your first department. Okay, so this will be macam small orientation for your first department. Okay, but recently during pandemics, most hospital are becoming more strict lah sebab diorang tak nak a lot of people in the ward. Okay, so alternative is you can find any senior houseman yang cuti waktu weekend tu. Okay, ask them to share what to expect on your first posting. Okay. Okay, so okay, hospital orientation is when you get to know or you can choose your first posting, and you will what I recommend to is for you to arrange pre-tag or small ward orientation session with your senior houseman, and that is when you can fill in your excellent HO planner. Okay, so bila you jumpa senior houseman before your actual tagging, then you can ask your senior houseman what are the requirement to off tag. Okay, what are the common off tag question, assessment berapa kali dekat kita punya posting ni. Okay, lepas tu senior specialist mana yang baik, mana yang garang, apakah pantang larang or incident of concern that you need to avoid in this posting. Okay, so what are the common topics? Banyaklah, nanti I'll show you your pre-tag list. Okay, and why it is extremely important to do pre-tag if you can do it, and why pre-tag macam ramai yang buat pre-tag ni they are less nervous and they can function better lah during tagging. Okay, so this is your 6 mandatory posting. So you will start your first posting from the first 6. Okay, so elective ni usually 5th or 6th posting lah. Okay, so you can most hospital they will letakkan you accordingly. Some hospital you can pilih lah. Okay, and some hospital has special rules. Contoh, ada certain hospital pediatric is only for senior poster. Okay, ada certain hospital or NG or do not accept first poster. Okay, so they have this kind of rule which you can ask from your senior houseman so that you know. Macam contoh, you tahu you punya hospital tu first posting dia tak ambil ONG, so you are safe from ONG. So basically you can narrow down your revision for the first final weeks during the last final weeks tu for other posting lah. Okay, so kalau you tahu macam medicine atau PITS untuk senior poster je, so you can focus on other posting. Okay, bacalah common case, common diseases, common procedure untuk posting yang lain. Okay. Okay, so I will spend about my 5 to 10 minutes about pre-tech or elective checklist. Okay, so these are the list of things that I propose you to learn before your actual tagging begins. Okay, you can learn by coming to the wards during weekends before your actual tagging start, because usually actual tagging kita ni the first working day of the week. Okay, you habis hospital orientation 1 minggu, weekend tu off, then next Monday, ataupun kalau you dekat apa ni Terengganu, Kelantan atau Johor, next Sunday tu you start tagging. Okay, so you start masuk ward the first day or the first working day of the week where everyone is overwhelmed dengan banyak plan. Okay, so they have less time to teach you. If you come during the weekends, so weekends ni round yang TDS 3 kali jadi sekali je. Okay, a lot of procedures, a lot of operation and investigation cannot be done outside office hours. So your senior housewomen are usually more free. Okay, they have the luxury of time to teach and bring you around the wards, okay, and teach you the basic stuff, so that when your first actual tagging period start on Monday or on Sunday, you tak adalah, you doesn't start from zero. You know what to expect. You know to function a little bit. Okay, so these are the things that these are the list of things that I propose you to do or learn during your pre-tag. Okay, kalau tak sempat pre-tag pun tak apa, belajar waktu tagging. Okay, so and you see how overwhelming it is. Okay, so first what you need to know on your first few days in the department is department layout and orientation. Okay, so you need to know your department have how many wards. Okay, so for example, if my medical department have 4 male ward, 4 female ward, okay, and 1 dengue ward, 1 CCU, 1 TB ward, 1 hemato ward. Okay, so there's 12 wards for medical department, and they are not located in one single building. So they are scattered. Okay, ada yang atas bukit, ada yang dekat tepi parking sana, so jauh. So you really need to know the orientation and layout of your department. Okay, if you are in surgical base, you need to know how many OT you have. Do you have poly OT or minor OT? Okay, and first you need to know the whole department lah. Ada berapa, kalau ONG is more complicated. Ada PSC, ada antenatal, ada postnatal, ada HTU, ada low risk birth center. Okay. Okay, so you need to know the floor plan of your department, and then within your ward itself, ada procedure room, ada pantry, ada doctor's room, ada toilet, ada surau. Okay, so nak cari barang dekat mana, kalau okay, dressing trolley semua nak cari dekat mana. Okay, so you need to orientate yourself within your ward as well. Okay, kejap nak pasang slide dah habis bateri. Okay, I'm back. Okay, so what else you need to learn during pre-tech or your first few days in the department? Okay. 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 After knowing your floor plan, okay, what you need to know is okay. Okay, sorry for the technical glitch. Okay, so next thing is you need to know what is your what workflow on timing. Okay, what workflow is what we do on daily basis, means jadual kerja kita dalam ward lah. Okay, so maksudnya usually the normal the normal workflow will be pagi-pagi houseman akan buat round. Okay, and then MO akan datang, specialist akan datang, then we do the active plan, and then the PM round, and the cycle continue lah. Okay, so you need to know berapa kali work round in each department. Okay, you need to know some department have morning passover. Okay, so some department require all the housemen to be in the morning passover, means you need to come much earlier to do your round and then go to passover, and then lepas habis passover baru kita akan buat round dengan MO. Okay, so ada department yang round sekali sahaja, ada department yang round 2 kali AM and PM, ada department yang round AM, PM, TDS juga. Okay, so you need to know what is your what workflow. So teaching hari apa, teaching pukul berapa, teaching wajib ke tak wajib. Okay, so you need to know so that you can manage or prioritize your work. Okay. Okay, so next is how to do your review. So macam mana nak buat review. Okay. Then you kena tahu juga biasanya kena cover berapa patient. Okay, so kalau kena cover ramai patient means you need to come much earlier. Okay, so kalau department ni baik, Tegus dia suruh review satu atau 2 patient, so you need to estimate what time you need to come every day doing rounds. Okay, and then okay, you need to know how to do referral request. Okay, so this pre-tech checklist, okay, or I call it elective checklist, because kalau you all buat attachment sebelum the COVID area lah, medical grads boleh buat elective attachment kan. So these are the things you should learn when you do attachment, and these are the things you need to know when you are new in each department as well. Okay, so you need to know the common procedure. Okay, so kena tahu cara nak buat lah. Okay, like we mentioned before, indication, contraindication, step by step, how to perform and how to document as well, in complication and how to document as well. Okay, so bila you dah masuk dalam ward, you need to know how to fill up common forms and order investigation if you are in a computerized hospital. And 6, which I have mentioned before, you need to know your superiors. Okay, so you kena tahulah MO dekat department ni macam mana, siapa yang garang, siapa yang okay, okay, specialist macam mana, what are the do and don'ts. Okay, okay. And 7, what are the books, reference or apps they use in that posting. Okay, so mana yang boleh beli, mana yang boleh download. Okay, what are the things you need for each posting. So for each posting usually ada benda yang houseman kena ada lah. Contoh macam pediatric, Frank Shan, and your your calculator. Okay, kalau medicine you need to have your pen torch. Okay, kalau ONG you will need your obstetric wheel kan, nak kira the LNMP and the scan that everything tu kan. Okay, so ask your senior houseman what do you need, and kalau if you can prepare them before your actual tagging, it will be extremely helpful lah. Okay, last but not least, what we have mentioned before, okay, you need to know assessment, structure and deadline. So kena tahulah berapa kali assessment, bila kena hantar logbook, okay, bila kena present CME, okay, and you need to know all these deadlines so that you can plan. Okay, so kalau ada excellent HO planner tu, boleh fill in and mark all the deadlines so that you are aware with your posting lah, throughout posting tu you tahu. Okay, so I think that's that's all from me today. Okay, thank you for staying. Lama pula, 1.5 jam dah. Sebab banyak cerita dan you all banyak tanya soalan. Okay, thank you for staying up to this point. Okay, so there's few question from Zaid Razali. Do we all know our posting rotation throughout the housemanship during hospital orientation or just our first posting? Okay. Usually yang you tahu waktu hospital orientation ni is only your first posting. Okay. Very few hospital, ada satu atau dua, saya tak ingat hospital mana, dia memang HUKM satu, if not mistaken, and Selayang kalau tak silap. Bila you orientation tu, you dah tahu dah rotation you daripada first posting sampai sixth posting. Okay. So usually you tahu yang first posting sahajalah. Okay. So Nasha Zahari, is there any online course? Yes, insyaAllah we will start our online course for pediatric, but it won't be a pre-record lah. Dia akan jadi live online courses. Okay. Okay. And last but not least, okay, so remember to submit your mentorship form bila you dah habis e-houseman. Kalau tak pernah join apa-apa program Medicop, you can join the mentorship program as well. Okay, so lepas e-houseman boleh start asking around from your senior houseman about your hospital, and then bila dah hospital orientation dah tahu your first posting, okay, arrange for pre-tech is possible. Okay, and my last announcement, okay, before we end our session tonight, okay. Kejap lagi tengok dekat komen siapa yang bertuah dapat free seat, okay. Okay, and last but not least, okay, Medicop will be having our Chinese New Year sale starting from tonight, okay, tomorrow, till next Thursday for 1 week, okay. So we will have sale on our online store. You can have free postage for all purchase above 120 ringgit, and also free excellent HO planner worth 10 ringgit for all purchase. Okay, and also for our online courses as well. Okay, so I will share more details on my Telegram channel. So thank you everyone for your time and attention. Okay, we will announce the lucky winner for Clinical Skills Workshop on 21st February shortly in the comment section. Okay, thank you. Till then, happy Chinese New Year for those who will celebrating the Chinese New Year. Okay. Okay, Assalamualaikum. Good night.